decided that you want to become a medical doctor. You have the grades for it, you've watched Grey's Anatomy, you've watched Code Black, you've watched Scrubs, you're there. You're like, the operating room calls me like the ocean calls Moana. This one is my calling. That white coat is going to be mine no matter what. So before it becomes a decision set in stone, wait a bit, come sit right next to me. Let me tell you a few of the things I wish I knew before I decided to become a medical doctor. My name is Dr. Uza. Welcome to my channel. I realized that the biggest reason people want to become medical doctors is so that they can heal the sick, should I say. You want to lend a helping hand. You want to save people's lives. That's the biggest, that's the most inviting title that there is. I want to become a doctor. I want to save people's lives. Apart from the money and the prestige, that is the big noble calling that we have, to save lives. So, in true fashion of the pessimism of the medical profession, I'd say the worst thing about being a medical doctor is having such a goal and realizing when you start practicing that death is real. It's the biggest bummer. It is something that you have to learn to deal with as a medical professional. It is something that we did not choose, but that is there. It is part of life. And because you have decided to go into a field that deals with human life, that is a reality that you have to come to terms with. Death is real. I remember losing my first patient. I'm not saying, I don't mean it in the way of you're a medical student, you happen to be in this ward, and then somebody dies. I'm sure that is a traumatic experience. But for me, I mean, your name is on the file, your handwriting is the one that has told the story of this patient. You are the one who has seen this patient from the beginning, and then somehow you get to reach the point where you call their time of death. She was 2 years old, but she looked a bit big for her age. She looked 4. She came in, it was around midnight. And while I was still taking history for this patient, while I was still asking the mom what had led to the baby coming to the hospital, the baby changed condition, and then we had to start resuscitating. We tried our best to save this baby's life up to like 3 hours of just fighting. And after managing to take her to ICU, put her on a ventilator, I was just called back to say your patient has collapsed and you have to go and break the bad news to the mom. And this was a woman who had lost her husband earlier in the year due to COVID. And then, like 6 months later, her baby gets sick. And then they came to me. So that's that situation taught me a lot. Lessons I got from that encounter was that, one, no matter how painful that situation was for me, no matter how much effort I had put, no matter what I had done, that that wasn't my moment. The pain I was feeling in that moment could never be equal to that mother's pain. Everything that had happened up to the point when I told her that we have done the best that we could, but I'm sorry, we have lost the baby. It was more devastating to her, and I had to allow her to have that moment. Yes, it is not an easy thing for patients to lose their loved ones. It is not an easy thing for parents to lose their children, for children to lose their parents, or even someone who was just your neighbor, but you're the one who took care of this person throughout the time they were admitted. It is not an easy experience to lose a patient. So, first and foremost, we have to respect the grieving family, and we have to put their grief before any other, should I say, any of our positions, any of our burdens in that moment, no matter how many other patients that you have to attend to, no matter how many other deaths that you have witnessed, no matter how regular this an occurrence this is, that was her daughter and she lost her, and it was a sad moment. The second lesson I learned from that encounter was that I am a medical doctor, and with that title comes responsibilities to me and also to my patients. Before that, if you call me doctor by my parents or my friends or people in the society, I'd be like, not yet. But that experience had just pushed me over the edge and made me realize that the honeymoon period was over. The books that I had studied, the things I had done, uh, this was the time where I had now to own my knowledge, to tell myself that I am responsible for people's lives. So if there's a proactive way I can take to prevent such an occurrence from happening again, I should. And in moments where I am unable or I do not know what to do, there is no harm in asking for help. Yes, a patient belongs to all of you as a unit, and you can always ask for help to your immediate senior when you feel that the situation you're in right now is not going to work out. And when you decide to be a doctor, when you decide to leave that as your job, as your lifestyle, it's a responsibility to yourself to do the best that you can do, to bring your best every day, no matter the stress you're facing at home, no matter what is going on in your life. When you go to work, people have come there because something is wrong in their lives and they think that you have the answer. Even if you do not, you're in a position to understand their disease more than they do. So that is a responsibility to them as well. So you have to do your best. It was a very big wake up call for me. And the third lesson that I had learned from that encounter was that God is in control of everything. I know for most doctors, when we heal a patient or we work on a patient and they survive, we like to take the credit. And then when things go wrong, we'll be like, it was God's will. There was nothing we could have done for them. So I learned to say that if I'm going to claim the praise for doing something good, I also have to come and claim the responsibility when something goes wrong. And that is not something that I believe in. I believe circumstances beyond our control happen in when it comes to life or death. If it is your time to die, you will die, no matter the best uh, medical services that you have. And if it is your time to live, it is not yet your time to die. It doesn't matter how bad you are hurt or in what horrible circumstances you are put in, you survive. So I like to think about it in terms of I do my best on my part, but ultimately the healing or the taking away of the patients, everything is in the hands of God, and I like to leave it there. Yes. So, you who has decided that this is the path that you're going to take, just know it comes with a lot of responsibility. And as a medical professional, you're going to meet death more often than the other population, than the normal population. And how you learn to handle death builds you as a human being. It shows who you are going to be. So you need to get comfortable with being uncomfortable in that position. In as much as you're a doctor, you save lives, death is also a real thing, it's a real part of life, and it is something that you have to handle more often than not. If you decide this is the path that you want to take, be prepared for such encounters. See you next time.